Good morning, everyone. Today I'm going to give you a concept of low therapeutic ratio drugs. Plus, we will talk about the drug testing other ways. I write over here urine drug testing, but I will talk about all the ways. So, why I wrote like here about urine drug test? Because to tell you that a number of drugs can be, or you can say, or drugs metabolites uh, can be metabolites. So they can be detected in the urine. So what we call it as urine drug screening or screen. So for example, okay, these tests are done mostly on medical legal cases or when you are applying for a or the requirement is from some authority, um, just for a general check or just on a suspicions of some potential drug abuse, like athletes, they check their body either they are taking any kind of drugs or not. So a number of drugs like amphetamines can be detected, barbiturates can be detected, benzodiazepines can be detected, methadone can be detected, um cannabinoids. Cannabinoids is all the hash or marijuana, you know, which is quite um, famous drug. Many people they abuse, and it is legal in many parts of the world. Or cocaine can be detected, or cocaine metabolites can be detected. Lysergic acid can be detected. So many drugs. I can not talk about all the list over here, but a lot of drugs can be detected. Okay, basically, you can say when we talk about the drug test or the drugs test, it is not just the urine, but rather all the body secretions may have the drugs which you are abusing can come in that. For example, urine we discuss, or you can say it can become into your saliva, it can become into your blood, can be detected even in your sweat, or you can say yes, even in your hairs. And hairs are very important thing. I will tell you why. Because let's take the example of um, hash, or what you can say marijuana, or cannabis, tetrahydrocannabinol. Okay, that can be detected in your hairs for 90 days. Okay, that can be detected in your hairs for 90 days. Okay, for if I will say breath, if like the police, whenever they like stop you somewhere while driving, so they ask you to puff or inhale or exhale in this uh, mouthpiece. So what they are checking is basically they are checking your blood alcohol levels, because the ethanol or alcohol, it can present in your breath, and like the analyzer can analyze how much is the levels, simply. So of course, like there are different type of tests which are available. And of course, like it would be very long if I will start talking about which drugs are present in which parts, uh, okay, and for how many days. But to give you the concept, um, you can say, um, like it's a general concept. Remember, whenever you are going to take any drug, okay, so whenever you are going to take any drug, or whenever anyone is going to take any drug, or rather in this case, is like the hairs. Hairs um, can give positive results, or I think so. Like I should rephrase the sentence. You can say uh, hairs, uh, hair specimens can have detectable, you can say, range for up to 90 days. That's very important. Now, what it means simply, no matter what kind of thing it is, for example, it's alcohol, it's cannabis, it's cocaine, it's heroin, or it's any other XYZ. Um, by the way, even nicotine, nicotine or any drug, they can be detected in your hairs for up to 90 days. So this is a very, very, very important thing. Now, many people, they get concerned and they ask like, I am going for a health checkup, and can you tell me like if alcohol or if, by the way, most of the people, who ask, they are basically abusing cannabis. Okay. So whenever like they are going for any medical checkup, they ask the doctors that I am taking marijuana or hash, churs, ganja, garda, whatever. Like these are different names for the same thing, and they are present uh, worldwide. And really, I don't think so. Like anyone can know all the names, what they are called in different parts of the world. But most of the people, who are taking cannabis, they ask that we are going for the blood test, and or a medical checkup. So for how many days, this one can be detected. So if they are not taking your hair sample, so of course you are safe if you have not taken it for like for so many days. So um, of course, like you are safe in that case. But if they are taking your hair sample, so up to 90 days, it can be detected. That makes around 3 months. Cannabis, like I'm giving you example of this thing. Um, Anyone who is using cannabis and he is a heavy user or he is an abuser of cannabis, guys, it can be detected in the urine for up to 90 days. Or you can say maximum up to 90 days, because maybe after 30 days it will not be detected. So if someone is not a heavy abuser, like you can say he take it on and off, so it can be detected up to 10 days in infrequent users, or you can say in occasional. Of course, like occasional users doesn't means like you are using it occasionally on daily basis, no, but rather if you're taking it occasionally means like once in a blue moon type of thing. And a very nice information for many is like if you are a passive inhaler, like you're just sitting in that room in which like there's someone is consuming that, so it can be detected in urine for up to 15 minutes. Okay, so they are safe, of course. So this is the point about cannabis. So of course, like I cannot talk about all the things, but again, I will talk if I will talk about cannabis in the hairs 90 days, in the urine for heavy abusers 90 days maybe, and in the blood it will be present for 2 to 3 days. Okay, and then of course like it will be gone. So of course, like it is the metabolites which can be detected in the blood, and if you haven't taken it for the last 1 month, so you are completely safe. Um, Even in the urine, by the way, because I told you uh, up to 90 days, which, or you can say it is like up to 30 to 90 days, because again, these are different statistical data collected from different parts. So that's the reason. So now alcohol can be detected in hairs, in in urine, in blood, in sweat, in breath. Okay. Same with all the drugs. They can be detected in any part. They can be detected anywhere, not in the breath, but like the other things. And the first thing, remember, guys, the urine and the blood, they clear up the things very fast, but the hairs, the things can stay in the hairs for up to 90 days. Okay, so this thing is the important point. One thing, like why these tests are done again for most of the time for legal things, not like normally they do. Nowadays, by the way, they have some special testing kits, special testing blood kits and special testing urine kits. They have breath analyzers, and what they do, like they can just take your urine or blood and they can put the drops of it, or you can say some part of that sample in that testing kit, and quickly it can give the result. Okay, and then of course, like they can run some confirmatory test just to check like either the person have that thing or don't have that thing. And as you know, like there are um, many times in the news it comes like some of the um, athlete, he had uh, they caught him and he was using some steroids or anabolic drugs. So of course, that's how they check them. Okay, so that's how they do it simply. um, what you can say nowadays, there are, you can say, some special um, spray drug testings are also available. What they do, um, like they spray the drug, uh, like what you can say, they spray your sweat on that kit simply. Okay, and like it changes color if someone is using something simply. Okay, so that is the important thing. And the other thing which I wanted to tell you is just a concept about like there are many drugs with a low therapeutic range or ratio. So what is this one? Um, Whenever we put any patient on any drug, so the drug levels should be this much in the body, in the blood, to cause certain effect. For example, if you want to take an antibiotic, for example, amoxicillin. So if you will take around 2 milligram of amoxicillin, so of course, like once you will take that, it will go inside your body, and what will happen, that there will be no therapeutic effect of that dose. Why? Because that dose is not enough to cause the effect. Okay, so um, you can say uh, there is a level of drugs level of drugs are there to achieve a therapeutic um, goal, right? And now, of course, there is a level. So, of course, like we must give either that level or more than that level. For example, Cefexim, whenever we have to give to any baby, we give it like 8 milligram per kilogram per day. But if the baby is a suspected patient of enteric fever, we increase the dose, because now the therapeutic dose of that medication to treat enteric fever is high. But at the same time, Cefexim has some level which will cause toxic effect or poisoning. Or so you can say there is a levels of drugs which are considered, or which can cause, not considered, which can cause toxic effects. right? So simply remember, for example, I'm just giving an example. Drug A um, have therapeutic um, level of 20 milligram per ml or per liter. And the same drug A, have toxic level of 200 milligram per liter. So what it means, now we have a big range here. Of course, if we will give less than 20 milligram per liter, it will not cause any effect. So of course we can give 30, we can give 40. So see, in this drug, we can give 30, 40, 50, 60, 70, 80, 90, 100, 110, 1. Below 200, everything is safe. So see, there is a big range we can play with, right? Now, let's take one more example of a drug. Uh, for example, there is a drug B. Now, the drug B therapeutic range or level is 20 milligram per liter. But at the same time, the toxic level of 30 milligram per liter. Now, below 20, it is not going to cause any effect. So we can have to give 20. But if we will give more than 20, we must keep it less than 30, because at 30, the toxic level will reach. So this one have high therapeutic ratio, but this one have low therapeutic ratio. So simply, drugs with a low therapeutic ratio have a small difference between a helpful blood levels for treatment and toxic levels. And the plasma level of such medications should be measured on timely basis or on routine basis to see either we are giving the patient the therapeutic ratio, the therapeutic levels, plus we should not give anyone the toxic level, or simply we must check their level of drugs in the body. So, for example, there are many drugs, like these are just examples, there are many, but I'm just giving you examples of drugs with narrow, or you can say small, therapeutic ratio. One of the most important drug is digoxin. We give it, like it's a positive inotropic drug, we give it to the CCF patients, like congestive heart failure patients. One of the drug is theophylline. We give it to the asthmatic patients. One of the drug is lithium. We give it to the mood disordered patients. It stabilizes the mood. One of the drug is phenytoin. We give it in the epileptic patients. And there are certain antibiotics like gentacin or gentamicin. If you are living in UK, it will be called as gentamicin or gentacin or vancomycin or tobramycin. No, now see, these drugs uh, like okay, I should write it mycin, I think. Gentamicin, for example, it have a good gram negative activity, but it also is ototoxic, or it can damage the ear. It is also nephrotoxic, it can damage the kidneys. Now we must be very careful when we are giving anyone gentamicin, because, for example, someone who comes with a kidney infection, you give him gentamicin, but the drug therapeutic ratio is low, so maybe you give him a toxic dose and maybe he will become deaf, right? So that's the important thing. So of course, like, we keep on checking their levels, but Again, I would like to mention digoxin here because digoxin affects the heart. So digoxin have, you can say, somehow the same story like TCA. Whenever there is digoxin toxicity, it can cause arrhythmia, so we can see the changes on ECG. So when we put the patient on digoxin, we should either do ECGs or we must do ECG in case anyone have digoxin or we are suspecting anyone have digoxin toxicity. So that's all for now, guys, about this topic. I hope you understand. So I will see you in the next lecture. Thank you so much.